Good afternoon, everyone. Myself, Madhu Kushwaha, Assistant Professor in SIRT Pharmacy, Bhopal. Today we will discuss about leukotrienes. Leukotrienes are a family of eicosanoids inflammatory mediators produced in leukocytes by the oxidation of arachidonic acid and the essential fatty acid eicosano- eicosano- eicosanotic acid EPA by the enzyme arachidonate 5 lipoxygenase. Leukotrienes use lipid signaling to convey information to either the cell producing them, autocrine signaling, or neighboring cells, paracrine signaling, or in order to regulate immune responses. The production of leukotrienes is usually accompanied by the production of histamines and prostaglandins, which also act as inflammatory mediators. One of their roles, especially leukotrienes D4, is to trigger contraction in the smooth muscles lining and bronchioles. Their overproduction is a major cause of inflammation in asthma and allergic rhinitis, and leukotrienes antagonists are used to treat these disorders by inhibiting the production or activity of leukotrienes. This is the introduction of the leukotrienes. Types of leukotrienes. First type is leukotriene B4 and leukotriene C4 and leukotriene D4 and leukotriene E4 is the types of leukotrienes and synthesis of leukotrienes. Membrane phospholipid when chemical or mechanical stimuli activates phospholipase A. In the presence of phospholipase A, membrane phospholipid convert in arachidonic acid, and arachidonic active metabolite is cyclooxygenase. In the presence of cyclooxygenase enzyme and lipoxygenase enzyme, it convert in PGG to 12 HPETE, and third one is 5 HPETE, and this PGG2 further convert in PGS2, and this PGS2 is further convert in isomers, thromboxane synthase, and prostacyclin, and these thromboxane synthase further convert in thromboxane A2 and thromboxane B2, and the 5 heptate is further converted in leukotriene A4, and then this A4 is further converted in leukotriene B4 and leukotriene C4, and leukotriene C4 is the synthesis of leukotrienes, and monteleucast and zafirleucast is the antagonist of leukotrienes. The mechanism of action of these drugs blocker cis leukotrienes are and prevent effects of cysteinyl leukotrienes, leukotriene C4, leukotriene D4, and leukotriene E4, blocks by the cis leukotriene R and prevent effect of these. Pharmacological effects decrease airway edema, smooth muscles contractions, and altered cellular activity associated with the inflammatory process. In allergic rhinitis, decrease symptoms of nasal obstruction is the pharmacological effect of the monteleucast and the zafirleucast. Uses of the leukotrienes. Leukotrienes in asthma. Leukotrienes contribute to the pathophysiology of asthma, especially in patients with aspirin exa, exa, exacerbated respiratory disease AERD and cause or potentiate the following symptoms. First is airflow obstruction, increased secretion of mucus. Third is mucosal accumulation. Fourth is bronchoconstriction. And fifth is infiltration of inflammatory cells in the airway wall. And second uses of leukotrienes in dementia. And leukotrienes are found to play an important role in the lateral stage of the Alzheimer disease and related dementia in studies with animals. Thank you.